I want to tell you about that these are toxic drugs. They should be used with precaution. I have said it many times. I will again say, use it only when there are, if you are using it parenterally, then only use it when there are very serious infections and complicated infections, right? Now, what are the main toxicities of it? Then I will tell you the uses, right? We will have a full lecture on aminoglycoside toxicity. Briefly, I can tell you that this drug is a mean guy. This drug is a aminoglycoside. Aminoglycosides. We can write here, it's a mean guy. MEAN, mean guy. Why I'm saying that aminoglycosides are mean guys? You know why? That if it is going to produce toxicity, they will hit on your ear, kick on your kidneys, and leave you paralyzed. What? They will hit on your ear, toxicity. They are mean guys, right? They are mean guys. Aminoglycosides are mean guys. Why? Because they hit on ear, they produce ototoxicity. They kick on kidneys, they can produce nephrotoxicity. Nephrotoxicity. And they can leave you paralyzed. It means they can block the neuromuscular junction. So they can produce paralysis. Of course, anyone who hits on your ear, kicks on your kidney, and leave you paralyzed must be very mean guy. And it is so mean that if you give it to a female and she is pregnant, then they can produce teratogenesis. They can produce teratogenicity. Teratogenicity means damage to the fetus, and classically they produce bilateral deafness. It means ototoxicity to the fetus also. So these are not very safe drug, right? They are not very safe drug. The most important side effects: ototoxicity, nephrotoxicity, paralysis, and teratogenicity. Just remember, it's a mean guy which will hit on your ear, kick on your kidneys, leave you paralyzed, and if you happen to be a pregnant female, it also can lead to teratogenicity to the fetus, right? But here is one thing which is very important. So number one, use these drugs, I would again repeat it, only in those conditions where infections are very serious and very complicated. But even then, you have to take care about these side effects. Ototoxicity. Ototoxicity means toxicity on the inner ear. Inner ear means either to the cochlear damage or to the vestibular damage. Cochlear damage, it means problem with the hearing system, and vestibular damage, problem with the balance system, right? And unfortunately, cochlear damage or vestibular damage or both type of damages can be irreversible, right? So you have to be very careful, and never, if you are using aminoglycosides, please don't give another drug which is also ototoxic. For example, if you are giving aminoglycosides, if you have to give aminoglycoside, then please don't give loop diuretics. Loop diuretics are also ototoxic. For example, you should not give furosemide. You should not give furosemide. You should not give bumetanide. Yes, and you should not give ethacrynic acid. So, if you are treating a patient with aminoglycosides, as there is a high risk of ototoxicity, please don't add salt to the insult. Please don't add another ototoxic drug. So no furosemide, no bumetanide, no ethacrylic acid, right? This is one thing. Secondly, these drugs can also be nephrotoxic. And this nephrotoxicity with aminoglycoside is very common. About 10 to 20% patients develop some degree of nephrotoxicity. The good news is that at early stage, if you detect the nephrotoxicity, if you stop the drug in time, this is reversible. Why nephrotoxicity is reversible? Because aminoglycoside basically primarily damage proximal convoluted tubular cells, and these cells have a great regenerative power. So if you stop the drug in time, right, the epithelial cells and proximal convoluted tubule will undergo regenerative system and renal damage will be reversed, but not in all cases, but in most cases. That is why before you give the aminoglycoside, you must be sure that patient's renal system is working well. Patient should not have any degree of renal insufficiency or renal malfunction. And also be careful in patients who are senior citizens. Usually they have renal insufficiency. And of course, if you are giving aminoglycoside, as you are keeping in your mind that nephrotoxicity can be there, don't add another drug which is nephrotoxic. What can be the other drugs which are also nephrotoxic? Vancomycin, amphotericin B, vancomycin or amphotericin B, vancomycin, amphotericin B. Please don't use these two drugs along with aminoglycosides, right, when there is increased risk of nephrotoxicity. Now, paralysis. As I told you, mean guy hits on ear, kicks on kidneys and leave you paralyzed because aminoglycoside interfere with the neuromuscular transmission, right, and can produce paralysis. That's why aminoglycosides are absolutely contraindicated. Aminoglycosides are absolutely contraindicated in patients with myasthenia gravis. But if paralysis happens, you need to reverse. If there is severe paralysis, you need to reverse it rapidly. Then you can use calcium salt intravenously, or you can use neostigmine. Right? Teratogenicity, I have already told that in pregnant women, it's best to avoid this drug because it can produce bilateral ototoxicity or deafness in the fetus. Right? Why I stressed on side effects of aminoglycosides before telling the uses. Again, later on we will have a proper lecture on ototoxicity, nephrotoxicity, how to evaluate the patient and how to prevent it and how to detect it, right? We will discuss a proper lecture on that. Aminoglycosides and ototoxicity, we will have a lecture on aminoglycosides and nephrotoxicity later. But briefly here, I just wanted to impress on your cerebral cortex that whenever you think of aminoglycosides, these are having serious side effects, only use when you don't have any other option. But here I would like to remind one thing. If you are using these drugs topically, as they are not absorbed, there is no problem. For example, gentamicin or tobramycin, they are very commonly used for ear infections, otitis externa, topical use, or conjunctivitis. So if there is ocular use or even skin ointment, of course that is safe because that does not lead to any significant absorption of the drug. But when these side effects are only important when you are giving these drugs parenterally. Is that right? I don't want someone come with septicemia and very happily you give aminoglycoside with penicillins as an empiric therapy. For example, patient survives, septicemia is clear, but later on patient has renal failure. That is not very wise treatment. Or patient become deaf. To manage this situation, in modern era of use of aminoglycosides, we use a special thing, special regime, that is high dose, long interval, extended interval dosing. High dose, extended interval regimen. Why we use it like this? To reduce the side effects. That I will discuss later, that how high dose and long interval use of aminoglycosides is very effective to kill the bacteria, but at the same time produces less side effects, because that requires two more concepts to be clarified. Number one, concentration dependent killing of bacteria by the aminoglycoside, and post antibiotic effect. These two things I will discuss later. Now we come back. Yes, you have a question.
Told us that nephrotoxicity is reversible. So how about the neurotoxicity and the ototoxicity? Or also reversible as well?
Ototoxicity in most of the patients, once it occurs, usually it is irreversible, and nephrotoxicity is reversible. The reason being, in ototoxicity, damage is mostly to the cochlear or vestibular afferent nerve endings or spiral ganglion or sensory organs of hearing and sensory organ of balance, right? Their afferent nerve endings are damaged and they don't regenerate. But in nephrotoxicity, damage is mainly on the proximal convoluted tubular cells, which have a very powerful regenerative capacity. That is why ototoxicity is usually irreversible, and nephrotoxicity, if you stop the drug in time, is usually reversible. Right? Now, after highlighting that these are serious drugs, then when to use it? Of course, they should be used in serious infections, and in most of the conditions, aminoglycosides are used with cell wall active agent to achieve the synergistic action, right? Because synergism, when you are using the two antibiotics, there are many advantages. Number one, bactericidal action is more effective. Number two, antibacterial spectrum become bigger. Number three, total dose is reduced, total side effects are reduced, and many more benefits, which we will discuss in future lecture in synergism between aminoglycosides and beta-lactam or cell wall active agents. Let's come back. What are the serious infections in which we use these antibiotics? Let's suppose we make a cartoon here. Yes, not very happy, having serious issues. Now, we will see on this diagram, on this person, in what conditions you can use aminoglycosides. I'm going to the clinical uses of aminoglycoside. If you don't remember anything, at least remember when you are using aminoglycoside topically, there's no problem. But when you are using parenterally, don't use for every susceptible organism. Only use it in serious conditions, life-threatening conditions, complicated conditions, right? Let's start from the top to the bottom. From the top, Aminoglycosides are used in, yes, neonatal infections, serious neonatal infection. What are serious neonatal infections? Of course, neonatal meningitis, right? Neonatal sepsis, right? Neonatal sepsis. We can use aminoglycoside, and of course, most common empirically combination which is used is gentamicin, of course, with salval active agent, mostly gentamicin with penicillins or ampicillin, right? Then we come down. Here are your beautiful large ears. Of course, you can use only for otitis externa, right? This is not serious, but here tobramycin or gentamicin or related drugs are very effective. Then we can say otitis externa. Then we can talk about ocular uses. Ocular uses are of course not in deep ocular, just superficial infections like conjunctivitis. Then you come down, you can use it for the superficial skin problems. But let's go back to the serious thing. Serious thing here, number one, neonatal meningitis and sepsis. Then you come down. Here is something very important. Your lungs. Yes. Many gram-negative aerobes produce very serious pulmonary infections, right? Or sometimes gram-positive multi-drug resistant cocci can produce very serious pulmonary infections. So in what pulmonary infections you will use these drugs, right? So let me write, in pulmonary infections, you can use it, number one, hospital-acquired multi-drug resistant organism producing pulmonary infections like pneumonia or pulmonary small abscesses, right? Here I want to tell you, there is necrotizing pneumonia and there is pulmonary abscess. Actually, nectrotizing pneumonia, there is small abscesses. When abscess is less than, pulmonary abscess is less than, what is that? Less than 2 centimeter and multiple, we call it necrotizing pneumonia. But when abscesses are more than 2 centimeter in diameter, we call it pulmonary abscesses. Why this differentiation is done? The reason being, when pulmonary abscesses are very small, less than 2 centimeter, they can be treated with antibiotics alone. They can be. But if abscesses become more than 2 centimeter, and as they keep on increasing their size, then treatment of those abscesses by simple antibiotic therapy becomes difficult. But let's go back. Pulmonary infections, serious pulmonary infections. We might use aminoglycosides if susceptible organisms are there. For example, hospital-acquired multi-drug resistant pulmonary infections. Then of course, a very important condition, that is cystic fibrosis. Patient with cystic fibrosis very commonly develop pulmonary infections with gram-negative aerobic organism. If you don't remember all of them, at least in this cystic fibrosis situation, remember one very important organism, that is Pseudomonas aeruginosa. Pseudomonas aeruginosa very commonly infect the pulmonary system of patient with cystic fibrosis, and many a times it is very difficult to eradicate this Pseudomonas aeruginosa from there, and many times it is fatal. So in such situations we can use aminoglycoside. It's a serious condition, cystic fibrosis with pseudomonal infection. So we can use aminoglycosides, and even tobramycin is used as inhalationally, right? And of course, this serious infection is tuberculosis. As I told you, pulmonary tuberculosis, especially when it is multi-drug resistant organisms, you can use aminoglycoside. Classically, we use streptomycin or amikacin or kanamycin, right? So we have seen that neonatal infections, very serious infections, right? Forget about conjunctivitis and what is this, otitis externa. They are easy to deal with topical applications. Then other serious infections are pulmonary infections. Either they are hospital acquired, because usually hospital acquired infection have multiple organisms, and unfortunately these multiple organisms may be multi-drug resistant, right? Then here is your beautiful black heart. I hope you don't have a black heart. So you have only a beautiful heart, but if someone develops infective endocarditis, right? Infective endocarditis is a serious issue. Why it is so serious issue? Because even though most of the time in infective endocarditis, bacteria are proliferating on the, what is this? On the cardiac valves. For example, if bacteria are multiplying on mitral valve, which was previously damaged, for example, due to rheumatic heart disease. Now, when bacteria are multiplying there, they are making large vegetations. But when they are making large masses or vegetations on the cardiac leaflets, this is serious infection. For example, here is mitral valve. Now on mitral valve, if some organism come here, what this organism will do? This organism will make a rapidly enlarging mass or vegetation. This mass will have the organisms, this mass will have the white blood cells and platelets and fibrin, and these masses are large and fragile. They are large and fragile vegetations. These infective vegetations are large and very fragile, so they keep on releasing bacteria in the bloodstream, or sometimes pieces of this large fragile vegetation break away and they go through the circulatory system to the distant areas and might produce multiple serious metastatic abscesses. So infective endocarditis is a very serious condition which can lead to septicemia, which can lead to multiple metastatic abscesses at the top of cardiac dysfunction. And why these vegetations have a high risk to produce septicemia and metastatic abscesses? One reason is, of course, they have bacteria inside and they keep on releasing in the circulatory system. Number two, because they have bacteria producing destructive and digestive enzymes, and neutrophils and macrophages are also producing destructive and digestive enzymes. So these are very fragile because these are not only loaded with bacteria and white blood cells, but there are many proteolytic enzymes coming from bacteria and coming from white blood cells, and the pieces break away and produce serious complications. And even they can perforate the valve itself. So if infective endocarditis is there, take it as a serious medical condition, life-threatening medical condition. So especially when there are multi-drug resistant organisms. For example, if there is enterococcal infection or pseudomonal infection or any organism which is aminoglycoside sensitive, then again we use aminoglycoside, but because it is a very serious condition, we will not use aminoglycosides alone. We will use aminoglycosides along with other drugs which should include cell wall active agents, which should include one cell wall active agent, right, to eliminate. So what we can say that infective endocarditis is one more condition which is serious, and we need to use antibiotics if susceptible organisms are there, right, along with in combination with salval active agents. Now we come below the diaphragm, right? Above the diaphragm, serious infections, aminoglycoside alone or in combination, mostly in combination, neonatal sepsis, neonatal meningitis, pulmonary serious infections like tuberculosis or pseudomonal infection with cystic fibrosis patient, or hospital acquired serious multi-drug resistant multi-organism involved infections, or then you go to the very serious infection, that is infective endocarditis. Then below the diaphragm, here is your abdomen and some serious infections or serious situation. Number one, okay, here is pelvis. Now in abdominal system, first of all, aminoglycosides are used in complicated intra-abdominal infection. Complicated intra-abdominal infection. Secondly, they are also used prophylactically. As I told you previously, neomycin given orally to sterilize the GIT. Classically, it will not kill all bacteria. You can say to reduce the bacterial burden of gastrointestinal system, right? So classically before the colorectal surgery or any extensive surgery of gastrointestinal system, we use neomycin, so bacterial load in the gastrointestinal system can be reduced. And other use, as I mentioned previously, in patients which have a tendency for hepatic encephalopathy, we love to reduce the bacterial burden in gastrointestinal system, and we use neomycin again. Why? Neomycin will stay in the GIT, it will not get absorbed and kill the bacteria there, right? Many of the bacteria in GIT. Why it is used? Because in hepatic encephalopathy, it is thought that GIT flora or bacteria produce certain type of toxins or short chain fatty acids or ammonia, which is normally through the portal venous system goes to liver, and if liver is functioning well, it will detoxify them. But in patient with hepatic encephalopathy, liver function is very significantly reduced. So these toxic substances which are produced normally by the GIT flora and which are normally detoxified in the liver, they will not be detoxified in the patient with hepatic encephalopathy, and they will go into general circulation, and once they reach to central nervous system, they damage the blood-brain barrier and microenvironment of the neurons, and that may lead to hepatic encephalopathy, right? So that is why aminoglycosides, especially neomycin, is used orally to reduce the bacterial burden in patient with hepatic encephalopathy, right? Now we come down. Here is your pelvis. Again, which pelvic infections? Not every pelvic infection. Those pelvic infections which are very serious and which are complicated. For example, intrapelvic infections, for example, complicated infections with multi-drug resistant organisms in female genital tract, or complicated UTI, urinary tract infections. We can use aminoglycosides. Now, we go further down. Above the diaphragm, there was neonatal meningitis, sepsis, these two serious conditions. Of course, neonatal sepsis is throughout, and then we can come to serious pulmonary infections, infective endocarditis, then serious intra-abdominal complicated infections, and then we come to prophylaxis. Prophylactically used neomycin in colorectal surgery, before surgery, or to reduce the burden of bacteria in the gastrointestinal system in patients who have a tendency for hepatic encephalopathy. Then serious and complicated infections intrapelvic. in which female genital tract infections and urinary tract, complicated urinary tract infections and complicated female genital tract infections, right? After that, of course, we should not forget serious infections can happen to bones and joints. Sometimes multi-drug resistant organisms produce osteomyelitis, which is very difficult to cure. So in those cases also, bones and joints with serious conditions, we can use aminoglycosides if we are expecting to have susceptible organisms there. And last but not the least, of course, there can be soft skin and soft tissue serious infection. For example, abscesses in the skin, diabetic foot, or very serious infections in the skin and soft tissue which are resistant to multiple drugs. Such organisms are there. Then usually we can use aminoglycoside in combination with, for example, in combination with cell wall active agents, right? So these are the clinical uses of, these are the different clinical uses of what? Aminoglycoside. And in many of these situations, we use what? Combination therapy. But there are two conditions, two clinical conditions in which aminoglycosides are used, and aminoglycosides are used as monotherapy. Those situations are